let's take a look on this side because you can see where it's kind of showing this ganglion here. And remember we said that the two roots of the spinal nerve carry different neurons. Okay, so what travels in the anterior root? What type of neuron? Motor, that's right. Okay, so remember we said that motor neurons, as you guys know, are multipolar, right? So if they're in the anterior root, it makes sense that they're going to have their cell bodies here. You guys know gray matter would be cell bodies, right? Okay, so that is where their cell bodies are in the anterior horn. Their axons travel out on the anterior root of the spinal nerve. Okay, so that's a motor neuron. Then that means sensory neurons must travel in the posterior root. Okay, so remember our sensory neurons are this type. Oops. Okay, so what type is that based on its structure? What do we call that? Unipolar, right. Okay, so we want to put that cell body here in this ganglion. That's what the ganglion is for. And so its axon is going to come in. Since it's in the posterior root, it makes sense. It's going to come into the spinal cord here in the posterior horn. So we'll just show it kind of ending there. Okay, so notice that here the two roots have come together. They're forming the spinal nerve. So the spinal nerve is mixed. Now you can see here how the spinal nerve has these little branches. These are called rami. Okay, so rami is branches, plural. Ramus is singular. So because the spinal nerve is already mixed, it has both sensory and motor neurons. These little branches here, actually the posterior one is really little, the anterior one's bigger. These are both going to be mixed. They're both going to contain sensory and motor neurons. Okay, so let's take a look at these two rami of the spinal nerve. And for now, we are going to just ignore these little rami here because these are for autonomic neurons. We're going to talk about that later. Okay? So, you guys have questions so far on any of that? Actually, there is a mnemonic also, just to tell you real quick, that if it might help you to remember what travels in the roots of the spinal nerve. It is AMPS. Or if you like spam better, you could really do it either way. Okay, so this is anterior is motor, right? The anterior root carries motor. The posterior root of the spinal nerve carries sensory. Okay, or sensory is posterior, anterior is motor. Either way. I think this is better because, I don't know, you could get mixed up with, no, I guess this works. Either one works. Okay, so if that helps you, there you go. Okay, so let's take a look now at another diagram so we can see what's going on here with these the little posterior ramus. Okay, so these are the two roots again. Okay, so now notice in this picture, they're showing you a little bit more here of this little posterior ramus. This is called the posterior ramus because it is going to go posteriorly. Now notice we don't have a lot of tissue here behind the spine, right? So not much of the body is back there. So these are very small. They do contain both sensory and motor neurons. Okay, so again, that's called the posterior ramus of the spinal nerve. So this just carries sensory and motor neurons back to the back, okay, to skin and muscle of the back. The larger anterior ramus is also mixed. It has both sensory and motor neurons. They're going to supply the anterior trunk and the extremities, okay? So the anterior rami are larger than the posterior. Okay, so this is called the anterior ramus of the spinal nerve. And again, we're going to just ignore these because these have to do with the autonomic nervous system. Okay, so now let's talk about the anterior rami because I think last time I mentioned how most of our spinal nerves form what's called a plexus. I did mention that, right? We talked a little bit about the plexuses, the networks that the spinal nerves form. I think we have to go back this way. Okay, so if you look at this closely, I know you guys can't all see this from where you're sitting, but if you have your picture in front of you, you can check it out. Notice that if you follow the spinal nerves out, you can kind of see this right here, where they're coming way out here, and in this area here. If you look at them closely, it looks like the spinal nerves are kind of getting tangled up together. And that's exactly what they're doing, but it's an organized tangle. So what they're doing is they come together, they literally unravel, they reorganize their axons, and they form new nerves that will carry sensory and motor neurons out to the same area together in a new nerve, okay? So that kind of network or organized tangle that they're forming here is called a plexus, okay? Plexus. So the word plexus really just means network. Oops. Okay. And you can think of this as being where the spinal nerves reorganize their axons, forming new nerves. When we talk about these plexuses and look at them up close, I think this might make more sense as far as why we have these plexuses, okay? So we are going to talk about the different plexuses here, but first, let's take a look at the spinal nerves in the thoracic region. Oh, and I'm sorry, one thing I meant to say, and forgot to mention it. When we're talking about the plexuses, what really enters the plexus would be the anterior rami of the spinal nerves. Okay, remember that little posterior ramus branches off and it goes to the back. So what we're looking at here, when you look at these nerves here, or the nerves in the plexuses, these are only the anterior rami of those spinal nerves that are coming together and reorganizing themselves and then forming new nerves. So let's just stick that in there. These are the anterior rami of the spinal nerves. You can't really see that on here, you can't really tell, because the little posterior ramus is so small, you know, you can't really see. I don't think they really even show it here. You just kind of have to know, okay, that branches off, it goes back toward the back area, and this is all, what you see here is all anterior rami that we're talking about now. Okay. So again, notice that we have a plexus here in the cervical region. There's one here where these nerves now are going to go down into the arm, and then in the lower nerves, down in the lumbar and sacral regions. But look here in the thoracic region, it looks like the nerves are just kind of traveling along the ribs. They do not form a plexus here. So the thoracic spinal nerves, the anterior rami of the thoracic spinal nerves, do not form a plexus. These are the only ones that do not form a plexus. And so let's take a look at those first in a diagram that's a little bit more detailed. Okay, so this is just tells you what a plexus is. And again, anterior rami. Okay. Okay, so the anterior rami of the thoracic spinal nerves are also called intercostal nerves. You guys know that costal refers to ribs. So inter just means in between. Notice these travel along the ribs. If you guys remember when you looked at the rib, there was that kind of groove that ran along the inferior surface of the rib, and that actually is where these nerves travel. Kind of forms a groove in the bone. So these are really, you look at this closely, you can see this is labeled as the anterior ramus of the thoracic spinal nerve. These are all thoracic spinal nerves. So this is what this would look like from T1 through T12. Okay, all the thoracic, anterior rami of the thoracic spinal nerves. So these anterior rami of the thoracic spinal nerves are also called intercostal nerves. You can see them on this model. I think we talked about this model a little bit last time because we talked about the spinal cord. So these nerves here that are between the ribs, these are intercostal nerves. Okay.
I'm kind of confused. So for the format for the test, are you going to be giving us like a variety of these different models, and then you're going to be asking us like what specific? I mean, the diagrams, and you're going to be asking us specific things about like, oh, what is the function of the posterior ramus
For the practical exam?
for the written part?
Well, there won't be any diagrams on the written exam. But I may ask you questions about what we're talking about. Yeah, so I may ask you, you know, which spinal nerves do not form a ramus, or excuse me, do not form a plexus. Or I may ask you, you know, intercostal nerves are formed by like the anterior rami of the thoracic spinal nerves, true or false? Okay. So, yes. Yeah, so there is no plexus in the thoracic region. Instead, the anterior rami of these thoracic spinal nerves just travel around along the ribs, supplying the skin and muscle of the rib cage. Okay? You can see here in this picture, if you look closely, you can see the little posterior ramus here. They're showing this one coming off, and this would go toward the back. Okay? So the little posterior ramus, and it actually is labeled here, is going to come back here and supply the back. Okay, the back area. So these are the anterior rami, which are also called the intercostal nerves. Okay? Other questions on that so far? Okay, so let's take a look now at the plexuses. Okay, so this is showing the cervical plexus, the one that's way up here in the neck. You can see it here, up close. And you can really see here how once these spinal nerves come out between the vertebrae, it looks like just a big tangled mess. But again, it's an organized mess. What they're doing is they're forming new nerves. So let's take a look at this, and again, I think it will make more sense when we kind of talk about this a little bit more. So this plexus is formed from spinal nerves C1 through C4. C5 contributes a little bit to it, but it really is considered to be from C1 through C4. And I would like you to know that, okay? And again, whenever we're looking at these are all the anterior rami of those spinal nerves, right? The anterior rami. The little posterior ramus has gone back to the back area. Okay, so one nerve comes out of this that I would like you to know, and it is right here. This nerve is called the phrenic nerve. Phrenic is a term that actually refers to the diaphragm. And so this nerve will actually go all the way down. We have one on the right and one on the left. It will go all the way down to the diaphragm muscle, and it supplies the diaphragm. So this is a really important nerve. This is a nerve that sends a signal, sends action potentials to the diaphragm every few seconds, causing it to contract. Without the contraction of the diaphragm, we cannot breathe. So, important nerve. Now, notice that the phrenic nerve, if you kind of follow these parts of the nerve up, you can see that actually it is formed by spinal nerves C5, some of it comes from C4, and some of it comes from C3. So those three spinal nerves actually contribute to the phrenic nerve. You guys know that the neck is a really vulnerable area. We always hear about people having neck injuries, whether it's from like a car accident or some kind of trauma, falling, or maybe sports injuries, very vulnerable area. And often people have disc herniations. The disc can kind of protrude and put pressure on the spinal nerve, and this can actually affect muscles. So as you can imagine, what if the diaphragm was supplied by just one spinal nerve, and we have some kind of injury to that area, or a disc herniation, where it's putting so much pressure on the spinal nerve that it affects the muscle contraction. This would possibly be fatal because, the diaphragm, again, if it doesn't work, we can't breathe. So this helps to ensure that nerve supply will hopefully still be getting through to those areas supplied by that nerve, even if we have some kind of injury in the neck, okay? So hopefully it wouldn't be, a catastrophic injury. So this is a protective mechanism where these nerves are formed by more than one level of spinal nerves. Okay? Does that kind of make sense? Okay, so that is the only nerve you need to know from the cervical plexus. Let's take a look now at the next plexus, moving down a little bit. And this is just a table that lists the nerves of the cervical plexus. I just wanted to show this to you just so you know. Your book actually goes into a lot of detail with the plexuses and these nerves. You do not have to know any more detail than what we're covering. So don't worry about any of that, okay? I just wanted to mention that. Okay, so this next plexus is called the brachial plexus. This name tells you it's going to have something to do with the arm. These nerves that come out of it supply the upper extremity. And this is formed from spinal nerves C5 through T1. Okay, C5 through T1. Notice, you can see here how, again, they're going to come together, kind of do this weird kind of mixing up of their parts, eventually forming these nerves shown here in yellow. And I would like you to know just the general area that these nerves supply. Again, your book is going to go into a lot of detail. It tells you the muscles supplied by each one. You don't have to know all of that. If any of you are going into physical therapy, this is the kind of stuff you'll have to know in a lot of detail. You'll have to know all the parts of the plexus and all the muscles supplied by each nerve. It's a lot of detail with joints, muscles, nerve supply. But for now, we are not going to do all that. And this is an actual photograph, as you can see, from a person, from a cadaver. And you can see how these nerves are traveling through kind of the shoulder area, and eventually will go down into the arm. So, and they're quite large here. So you can see how this would be an area where when people have injuries to their shoulder, which is, pretty common, it can affect the nerve supply to the upper extremity, and people can end up having all kinds of problems like numbness, tingling, and weakness in their upper extremity. Okay, so this is a diagram showing these nerves. We actually have a model that looks just like that, where you guys will be identifying them. So again, these are the nerves that come out of this plexus, and I would like you to just know the general area that they supply. So just what it says here. Okay, so for instance, the axillary nerve comes over toward the shoulder, and it supplies the shoulder area. So this would be the nerve that supplies the deltoid muscle, for instance. And if you're interested in exactly what muscles these supply, your book will tell you. It will even tell you the part of the skin each one of these supplies. Okay, the musculocutaneous nerve supplies the anterior arm. You guys remember, arm is just here, right? So anterior arm. The radial nerve is a large nerve that supplies the entire posterior upper extremity. So the posterior arm supplies the triceps muscles, all the extensor muscles here. And then these two nerves together, the median and the ulnar, supply the anterior forearm. The median nerve travels kind of right in the middle of the forearm here. This is the one that's usually involved in carpal tunnel syndrome, where any inflammation in the carpal tunnel area can put pressure on the nerve, and people often have numbness and tingling in this part of the hand, which is the part that's supplied by the median nerve. The ulnar nerve is more medial, so it supplies like the pinky and the ring finger, okay? The ulnar nerve actually travels between the medial epicondyle and the olecranon process, So this is the nerve that we feel when you like hit your elbow. Sometimes you feel that tingling that we call the funny bone. That is the path of the ulnar nerve. Okay. Questions? Okay, so again, if you're really interested in this stuff, your book goes into a lot of detail here. You do not have to know all the extra detail, but as you can see, it's there. Okay, so next plexus is the lumbar. This is formed from spinal nerves L1 through L4. Okay, and there are two nerves that come out of this that I would like you to know. These go down and supply the lower extremity. And you can see one of them is shown here, this kind of larger one, which is the femoral, and then there's a smaller obturator. Let's take a look at those as they go down into the lower extremity. You can see here that the femoral nerve is actually pretty large. This is the groin area, and it's next to an artery and a vein called the femoral artery and femoral vein. They all travel together down toward the thigh. Okay, so you can see here that that kind of small obturator nerve actually goes through the obturator foramen and the pelvis, comes down toward the medial thigh. So this nerve supplies the medial thigh. This would be the nerve supplied to the adductor muscles. And then the larger femoral nerve, you can see here, it's going to come down and branch onto the anterior thigh. Okay, that one supplies the anterior thigh. So that would actually be the nerve supplied like to the quadriceps muscles. So those are the only two that you need to know from this plexus.
I have a question about the practical exam regarding the plexuses.
Uh-huh.
Are you gonna show us the diagram where they're all coming out of the spinal cord, or is it gonna be only diagrams of the limbs?
I think I would ask you to identify plexuses and nerves on this model here. You can see the model actually looks like these pictures that show these nerves going out into the body, okay? You can also see the plexus. You can see like the cervical plexus here, the brachial as it's coming through the shoulder area. You can see the lumbar and sacral plexuses here, but you can also, kind of trace the nerves down and identify the nerves. Okay, so this diagram or model will be on the test. Okay. Okay, any other questions on that? Okay, and then the last plexus is the sacral. Okay, so the sacral plexus is formed from spinal nerves L4 through S4. And there is one nerve that comes out of this that I would like you to know, and that is this really big one. This is the largest nerve in the body. It is called the sciatic nerve. Okay, the C is silent, sciatic. And you may have heard of this because since it is really large, it's about 1/2 inch in diameter, it's often compressed as it travels through either the gluteal region with all the muscles that it has to travel, kind of between, or sometimes people have disc herniations in their low back that can put pressure on the nerve roots here. So that is felt as pain, usually down the posterior thigh, down into the leg, and that pain is called sciatica. So really, really common. And you can see also, notice in this diagram here, how it actually is formed by two nerves, but these are wrapped up in connective tissue. So they travel together as the sciatic nerve, but when this gets just above the knee, they will split. So I would like you to know the two nerves that make up the sciatic. And you can see it here. Notice how large it is. You can see it has to kind of travel right under the piriformis muscle. So there's a condition where sometimes the piriformis is really tight called piriformis syndrome, and it can actually cause sciatic nerve pain. Also, if you guys are going into nursing, you'll be giving injections, sometimes into the gluteal region because it's a big muscle, so intramuscular injections are often given in the gluteus maximus. And so you will learn how to avoid the sciatic nerve because you don't want to inject that nerve. You want to, inject this more upper outer quadrant of the gluteus maximus, so up in here, so you don't inject the nerve. Okay, so this is the diagram that shows the sciatic nerve coming down. You can see just above the knee it splits. This one that goes off laterally is called the common fibular or common peroneal. You can use either name. And so that's going to go laterally toward the fibula. And this one that comes down toward just the posterior leg, this one here, is the tibial. So these are the two nerves that really make up the sciatic nerve, and then they split. So I would like you to know those two also. And you can also see them on the model. Okay, so what does this nerve supply? It supplies the posterior thigh, okay, posterior thigh, and the entire leg, okay, the lower leg. Okay, and that is it for those nerves, the plexuses, all that stuff. That is it. Do you guys have any questions you can think of on any of that? Anything you want to go back to? Anything you want to clear up before we move on?